Pancreatic cancer survival rates have gradually improved over the past couple decades, but there's still much unknown about the cancer, and most cases are caught at later stages. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, during Pancreatic Cancer Awareness Month, we're talking about how genetic testing is expanding treatment options and a new screening test on the horizon that's exciting doctors. With me today is Dr. Addison Tolentino, an oncologist with St. Luke's Cancer Institute. Thank you so much for joining us.
Thanks for having me.
So, Dr. Tolentino, why is pancreatic cancer most often caught at later stages?
There are currently no screening for pancreatic cancer. We have mammogram for breast cancer, colonoscopy for colon cancer, but we have no such good screening for the general population. We have screening for high-risk patients, but that's still evolving. Another challenge in pancreatic cancer is that there's no early sign and symptom for pancreatic cancer. Once an individual has abdominal pain, jaundice, back pain, or changes in the color of stool, that may mean an individual has an advanced pancreatic cancer. So this is an area of research answering the question, how do we detect pancreatic cancer earlier? The good news is there are cases being caught today much earlier, and thanks to increased awareness. When I started to be an oncologist, I usually told my patients there are no good treatment for pancreatic cancer. It's 100% lethal. Mm-hmm. But today I have patients who I am still seeing on their 4th and 5th year of surveillance for pancreatic cancer after they have completed their treatments.
So because of some of those reasons you mentioned, genetic testing plays a really important role in catching pancreatic cancer early and in its treatment in some cases. Who should ask about genetic testing?
If a person has pancreatic cancer, I think that that individual should ask for genetic testing because it has therapeutic implications. In other words, if a person is found to have a certain genetic mutation such as BRCA, that person may be a candidate for a certain treatment called the PARP inhibitor, or a group of treatments called the PARP inhibitors. Those individuals with family history of pancreatic cancer, even if an individual does not have pancreatic cancer, should also ask for genetic testing. People with breast and ovarian cancer history in the family, history of colon cancer and melanoma in the family should also ask for genetic testing.
Now, can you tell me about the HighRisk Screening program offered at St. Luke's?
The HighRisk Screening program at St. Luke's started in 2017. St. Luke's is the only cancer program in this area that is nationally recognized by the National Pancreas Foundation. We are able to offer pancreatic screening for high-risk individuals. We are able to pick out those who should participate in the screening program by genetic testing and by their family history. This screening program will consist of alternating MRI of the abdomen on the first year, endoscopic ultrasound on the second year, and then MRI of the abdomen on the third year. The purpose of these tests is to detect any early pancreatic lesion that may give us an idea that a person may have an early pancreatic cancer.
Okay. So after diagnosis, what are the latest developments in the treatment of pancreatic cancer?
After diagnosis, most patients with pancreatic cancer will have to undergo testing to see if they are eligible to undergo surgery or no surgery. Some individuals cannot have surgery, but we discovered that the addition of chemotherapy prior to surgery may convert those individuals who cannot have surgery to a situation where they can have surgery, and that increases the chances of cure. New techniques include laparoscopic approaches, minimally invasive approaches in removing pancreatic cancer. We also are currently using immunotherapy, targeted therapy, and vaccine therapy, but that's only in the clinical trial phase right now.
Okay. Lastly, can you tell us about the potential game changer in screening of pancreatic cancer that we might soon see in the future?
A new technique in detecting early pancreatic cancer is blood tests. We are excited to be working with a company right now that offers a blood test to detect biomarkers in the blood. And this should be up and going soon. And we are excited to add this to the current screening. And the current screening consists of the MRI, the abdomen, EUS, or the endoscopic ultrasound, and then the MRI again on the third year.
Okay, great. Well, thank you so much for joining us.
Thank you for having me.
To learn more about pancreatic cancer tests and treatment offered at St. Luke's, visit stlukeskc.org/pancreatic cancer. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.